Yes, a combination of medication is normal. I have lithium, which is a typical mood stabiliser. I also have quetiapine and pregabalin, which are primarily antipsychotic. And I also have escitalopram, which is a antidepressant. It's also very common to change medications throughout the time that you are diagnosed. Some of the medication I've been on has been reduced. That's to prevent long-term health conditions. Equally, I've had 3 or 4 medications that I've tried in the past and have made very little difference that have since been withdrawn. So it is not uncommon to be on multiple medications for the same illness. Yes, I've had various talking therapies. That's not unusual. I've had CBT, DBT and other forms of psychotherapy. However, to say that talking therapies can remove the need for medication, that would be very, very rare. In fact, the idea is that you have the medication, you stabilise under the medication, and then you have the talking therapies. Giving a talking therapy, any form of psychotherapy, to someone who is unstable will either have very little benefit because they won't be receptive, or it could actually make the matter worse. Yes, I suppose an analogy would be if you had a broken leg, you wouldn't attempt physio on that leg until you had actually healed the leg. So it would be plaster cast, remove plaster cast, then have physio. And it's the same with mental illness. You use the medication, stabilise, and then the talking therapy. At the moment, no, there's no cure because there is very little knowledge as to what actually causes manic depression. There is no identifiable gene and there is no blood test or anything like that out there. It is unlikely, I believe, that a cure will be found in the near future. How long it would take to cure, I have no idea, because this is a psychological illness. It is not a physical illness. As you can imagine, I've done lots of reading, lots of research, and watched lots of programs about bipolar manic depression. This ranges from medical texts right through to biographies and things like that. The 3 resources that I would definitely recommend anyone who is manic depressive or has friends and family who are manic depressive is to watch the 3-part documentary by Stephen Fry, A Secret Life of a Manic Depressive. It's available on YouTube. I would also recommend reading a book that is actually not based on manic depression, but it does deal with the harder, darker side of depression. And that is a book called Shoot the Damn Dog. That is by a lady called Sally Breton. I definitely recommend that because it's a very informed read and a feel-good book, particularly if you are suffering depression at the time. The final book, or should I say books, are a collection of books by Kay Redfield Jamieson. Now the standout text by Kay Redfield Jamieson is a book called An Unquiet Mind. That is obviously all about bipolar manic depression. But Kay's written a number of other books that are very helpful, things like Exuberance. Her writing style is fantastic, and I tend to read her books when I am in a depressed state, purely because I feel like I'm talking to Kay when I'm reading that book. Personally, no, I've never been to a support group. It's not really my thing. Would I consider it in the future? Potentially. But group therapy is not my sort of thing. I will either put on a front and not be receptive to the group therapy, or I will sit on the sidelines and not talk. I'd much prefer one-to-one therapy. any time. Other people that I talk to, basically I talk to friends and family, all can offer something else. Family are able to offer the support. Friends I can sometimes talk to about things that I couldn't necessarily talk to family about for obvious reasons. I just have quite a strong network of people. The best experience I've ever had of talking therapy was the first meeting I had with my former psychiatrist. It was a really good meeting. I went into the meeting expecting the worst, and the fact that he was so straight and direct when he spoke to me, he gave sympathy and empathy, but not in a huge way. And that's by far the best experience I've had. I am not someone that likes a counsellor or a psychotherapist or psychiatrist to talk to me in a sympathetic tone. I just need to know what things are and where we go. Of course, after 28 years of receiving therapy, I've had some good experiences and some experiences that haven't worked. I think the worst experience is what I used to call my tree therapist. And every week at some point, I would be a tree in the middle of the forest, and all the other trees around me would be family, friends and acquaintances. And at some point, my actions would either keep all the trees happy or kill all the trees off. And that was just crazy. It certainly wasn't on my wavelength. Thank you. I'll see you tomorrow.